Increased potency results in increased toxicity and more overdoses. It's the same with fentanyl. So there are times when you will see a cluster if it's more potent than what people are used to. Or if it's a circumstance socially where there are more naive people trying it at the same time together, and because they don't have any tolerance, they may overdose and experience a poisoning. So it's not surprising, first of all, to see these kinds of clusters periodically, which is why within the drug-using community in Vancouver, because of their experience with heroin, they encourage people to test dose, to test the potency before they take a larger amount, or what they would consider to be a normal amount, to ensure that it's not stronger than what they have tolerance for. Well, when somebody is having an opioid overdose, what happens is it reduces the breathing, the respirations. So the breathing will become more shallow, it might become obstructed in some way, they'll begin to turn blue around the lips and in the nail beds, on the fingers. They may stop breathing altogether. They're hard to rouse. They seem like they're just drifting off, but if they can't be roused and they're turning blue, then immediately one should respond. It's not at all uncommon in the urine drug screens that I see to see cocaine combined with sometimes methamphetamine or fentanyl. With regards to fentanyl, sometimes it's sold that way as a so-called speedball, a combination of opioid and stimulant as a product. At other times, though, it may be put in there surreptitiously to get the clientele, the customers, dependent on the opioid, so they come back on a more regular basis for supply.
You certainly have naloxone kits that we can provide to the public. We have a model of one here. We do have a clinic twice a week where people can come and learn how to use the kits. And we also work closely with Mayfair Pharmacy, who also provides kits. So our naloxone program, we believe it's important that people consider having a naloxone kit with them if they or a loved one are using opioids or whatever they might be using and not be aware of what's in the product that they may consume. They should have naloxone kits, and we're happy to be able to work with them to provide that.
People are instructed to call 911 first of all, and then to check their airway, see if they're breathing, to ventilate if they're not, to give compressions if they feel comfortable doing that, but then to administer the naloxone in the situation that they think is a drug overdose.
They can access our services for addiction counselors by calling 306-655-7777. We also have our brief and social detox that people can access. We also have a methadone program that people can access. So there are services available for people that want to get support to address addiction.